Assalamu alaikum, sir.
Wa alaikum assalam.
So today we are going to talk uh, about basically the social spaces and to have the comparativist view of the Corona 19 the COVID-19 epidemic in Pakistan, and we will see that how it can be compared with the other countries. And in order to have debate and discussion about it, we have with us Dr. Ryan Brasher, who is the former Christian College University. He is the director and and the assistant professor in the Department of Political Science. So, welcome, sir. Thank you so much for taking us for taking out time for us. So, sir, as starters, my question to you would be, because I know that you are a comparativist. So, how do you compare the situation of the coronavirus epidemic in Pakistan, and do you see any commonalities drawing from what's happening in Pakistan with the other countries of the world or with the other South Asian countries as well?
That's a very interesting question. Now, my expertise is obviously not in epidemiology, or I'm not a virologist. But one thing that has sort of struck me is the way that this virus is really connected to social networks. And so in the social sciences, there's one stream of people who are what we could call, they're engaged in network analysis, social network analysis. And when we look at different countries, we can see that the virus entered the country and has spread along different networks. Now in Pakistan, there seem to be three networks. You've got the network of people who came back from pilgrimage in Iran, and that spread along those networks. So Gilgit-Baltistan was hurt first, I think. Then you have this Tabligh-e-Jamaat network in Islamabad, Rawalpindi, and that's spreading along those lines. But what is very interesting to me is that the coronavirus spread particularly among the wealthy traveling class of people. So people who come back from Spain, Italy, UK, other places, and brought the virus with them. I think you hear reports from Gujarat and other places where you have these, or wealthy neighborhoods in Lahore where the virus is spreading. So I tell my students, you're from wealthier neighborhoods, so the chance of you spreading it to poor people is bigger than poor people spreading it to you. Now, if we compare that to other countries, it's very interesting. I'm not entirely sure how it got into Italy, but I've been following the news in Germany, and the way it spread into Germany, to a large extent, was the fact that Germans love to go skiing during their vacation. So I think it's out of 80 million people, 14 million every winter go down to Italy and Austria and Switzerland to ski. It's a huge percentage. And all these people were in northern Italy and were catching the virus there and brought it back with them and spread it along those networks. Now, the interesting thing is that a lot of people were wondering, why is the German mortality rate so much lower than in Italy? It seemed like in Italy, 10% of the patients were dying, whereas in Germany, it was less than 1%. Some people said it's because of the extent of testing is much bigger in Germany, so they're capturing more people. That's why the percentage is lower. But the age group of people who caught the virus is also younger. And it's because of those people who went skiing. They tend to be younger, whereas in Italy, it's the older people who are affected more. So it's affecting each country in a different kind of way, depending on how the virus entered the country. In the US, you have such a mosaic of different communities, cultural communities, ethnic communities, immigrant communities, and the behavior and each of the social behavior in those communities is different. And the virus will spread differently based on that. Southern Europe in particular is such a social culture, an interactive culture. So I wonder if that has something to do with the virus spreading so quickly there initially. But these are just some observations I'm making. and thinking about.
So, Ryan, do you think that since the cause for the spread of the virus varies from country to country, or for that matter, from society to society, because social behaviors were different? So, do you think that a more contextual interventionist approach will be required for the prevention, or targeting and control, or the cure of this situation?
Um, Certainly. Now, I'm also not a policy expert, but obviously some things are the same across the board. Social distancing, the virus. I think in Pakistan sometimes people think that the virus is somehow hanging in the atmosphere, but it's spreading from one person to the next. That's the thing. So social distancing is obviously important, but in a place like Pakistan, especially the poor half of society, they're not going to survive on a lockdown for very long. So the deaths that could come from completely locking down the country and causing widespread economic need, and even who knows, starvation, that can actually cause more deaths than the virus itself. So one has to balance those things. A country like Sweden would be able to survive much longer on a lockdown than a country like Pakistan. But on the other hand, Pakistan is also more crowded. So that's these are just things one has to weigh, I guess.
Exactly. And just picking up from where you have left, because one of the important debates around is that the issue of social distancing, which you have also were touched upon in your first, as a response to your first question as well, that there are congregational prayers or mass prayers, and those really cause or can cause some serious threats as far as the spread of the virus is concerned. And another very important domain which we need to look at more critically um, are the slums, because they're the concept of social distancing, and not just about the social distancing, but also about the availability of the sanitizers, or for that matter, the proper washrooms, and the cleanliness and personal hygiene becomes a lot more of an issue as well. And I'm putting that question to you um, as well, because I know that one of your areas of interest is about minorities. And since most of the major chunks of the population of the slum constitute minorities, so what's your take on with that? Is there a greater plausibility, or can slums be the more vulnerable socio-physical spaces of the spread of the virus?
Yeah. So my hope is that the virus weakens before it jumps from the rich people to the poor people. Um, but yes, social distancing in poor communities that are also much more tightly packed is
Yeah.
of course more problematic uh, than social distancing. For somebody in Norway and Sweden, social distancing means locking oneself up in an apartment by oneself. In that kind of environment, it means locking up 10, 15, 20 people in one environment. I mean, that's difficult. And another element of this is aid that has been going to people who are not, particularly those who are daily laborers and that kind of thing. I think those are the most affected by this lockdown. I've heard from some people that have said that they are sort of being overlooked by certain charity drives that focus on Muslims because people are concerned that their zakat is going to earn them, um, you know, uh, uh, future points in Jannat. So they want to go. They wanted to go to fellow Muslims, and so some Christians are concerned that they're being overlooked. But I also think that there are plenty of attempts to raise funds and raise support and raise basic household goods for those from minority communities. But it'll certainly be a challenge. In terms of religion in general, some people have been criticizing and bashing religious figures for their silliness and insisting on continuing meetings, not just in Pakistan, but there's also certain, thankfully, very
Yeah.
minority of people in the US in Christian churches who are also continuing with this because they believe that somehow they will be miraculously saved by this. Uh, but I think these kinds of diseases and plagues are not a new thing in human history. Now, maybe for the modern human, it is seems unusual. But if we look at history uh, and we look at the response of religious figures in history, I was just reading on Martin Luther. Martin Luther, the Protestant Christian reformer in what is now Germany, 500 years ago, lived through and survived a plague in his town Wittenberg. And he was telling people, look, the plague is going on. We need to help, but you need to isolate yourself. You can't go about. He wasn't encouraging people to go to church. He was telling them to be safe and distance oneself from one another. So uh, we do see it's not that religious figures are all, irrational and telling people to do silly things. We do see good examples both in contemporary times and in history as well. Thankfully, I think was it the Al Azhar University issued a fatwa, to for
Mm.
religious figures to not have these gatherings, and obviously the Saudis have closed the Hajj, so I think religious figures should take these as examples and make sure that people stay safe.
Sure. Um, Ryan, my last question to you would be that can you propose some sort of methodological or analytical frameworks for mapping and identifying the vulnerably poor sections of the society who may be at the higher propensity or susceptibility of acquiring the virus? Um, can they be or are there more reflective or kind of eclectic methodological frameworks which can be tapped into to identify the at-risk groups of populations?
Uh, that's an important question. Uh, Obviously, that involves a large factor, a large number of factors. I mean, what I mentioned earlier, social network analysis would be one tool. And we know in Pakistan that it's certainly a very hierarchically differentiated society with very distinct social groups and classes. And so one should identify how they interact with one another. I mean, poor people oftentimes work as household help in the houses of wealthier people. That is one way that this virus can spread to the poorer group of people, because somebody's working in some household that have come over from they've come from Europe back to Pakistan, and that is how the virus spreads. So one should be very mindful of that. Um, so yes, paying attention to those linkages. That would be a methodological approach. Obviously, it's not something that I've studied much in the past, but then again, most of us have never studied this kind of phenomenon before. And I imagine there's going to be a huge spike in academic studies focused
Yes.
on global pandemics after this event.
Thank you so much for your time, Ryan. Thank you so much, and we'll stay in for contact for important academic transactions about the coronavirus. Thank you so much.
Thank you. Thank you.
Thank you. Thank you. Bye.